All right. Well, again, good afternoon. On behalf of Chair Schultz and myself, I would like to call to order this joint hearing of the Human Services Finance and Policy Committee and the Health Finance and Policy Committee. And appreciate everyone joining us this afternoon. I know here it is Friday, the end of a very long week. And I know everybody's waiting to be done today so that you can start your week off, although I know many of us will be, in fact, working quite a bit during that week off. But I know there's a lot of interest in the topic that we're going to be hearing about today, and that is the American Recovery Plan, the money that's coming to Minnesota from that act of Congress. And just to start off today in our joint hearing, I want to let you know that we're not going to take formal attendance. We're taking attendance. The staff will note who's here, but we're not going to call the roll because this is a joint hearing and we're really just doing an informational hearing today so that we can see what the administration is going to present to us in our budget areas, health, human services and health, and have an opportunity for member questions. So with that, unless the staff tells me I forgot anything I'm supposed to do, I think we can go right into it. And the first thing on the agenda then is to go to Dave Grieman, who's the budget director for the Department of Human Services. And I should note too that we have sent out some materials. I think what we've got are the presentations for today, so members will be able to refer to that later as well. Mr. Grieman, welcome.
Thank you, Madam Chair. My name is Dave Grieman. I'm the budget director at the Department of Human Services, and I'm here to talk this afternoon about provisions in the American Recovery Plan Act that affects human services programs in the state and the Department of Human Services. As I think everybody in the room knows, the American Recovery Plan Act was passed into law and signed into law on March 11th. That law provides Minnesota, the state, with approximately $2.577 billion in fiscal recovery funds, and also provides about $2.125 billion in similar funding to local units of government within the state. The law also includes a number of optional Medicaid provisions for states that I'll be talking about as well briefly during this presentation. And then it funds dozens of specific grants that go specifically to the Department of Human Services, and I'll be covering those as well. And those are more, the fiscal relief or recovery funds are a bit more flexible and can be used by not by any, but there are rules that they don't have to be, they're not limited to human services. So there's some differences in the funds. So, we expect to get formal first, I'll talk about the fiscal relief funds. We expect to get formal guidance later in the month or later, perhaps in April, regarding how we can use these dollars and what's allowable. But I thought I'd present a little bit about what we know right now based on our reading of the law. There are four primary allowable uses of the fiscal recovery funds. One is to respond to the COVID-19 or its negative economic impacts, including assistance to households, small businesses, and nonprofits. It's also allowed to be used to provide premium payments to workers performing essential work during the COVID-19 pandemic, and also to provide grants to employers of essential workers. The provision, it can be used for the provision of government services to the extent of a reduction in a state government revenue due to COVID-19. And then lastly, it can be used to make necessary investments in sewer, water, and broadband infrastructure. States may not use the fiscal relief fund or fiscal recovery funds to directly or indirectly offset a reduction in net tax revenue resulting from a change in law. So that's one limitation on the use of the funds. Just in terms of the process for awarding the funds, the Secretary of Treasury is directed to allocate the funds within 60 days after a state certifies that it will use the funds for allowable purposes. The secretary may withhold 50% of the funds for up to 12 months. The fiscal recovery funds are available until December 31st, 2024. And LAC approval is required to spend these dollars. Right now, we're not sure how different these dollars are going to be from the coronavirus relief funds that were passed as part of the CARES Act back in April. As you might recall, those dollars were not permitted to be used as a non-federal share for the Medicaid program, which placed some limits on how we can use those dollars. We don't know what kind of rules are going to be in place for these funds, but if the guidance is like it was for the coronavirus relief funds, the guidance will kind of dribble out over time. Unfortunately, we'll get one set of guidance and then it'll be modified. I think the coronavirus relief funds guidance was modified 5 or 6 times. So that's probably how we're going to learn about these funds at this point.
Mr. Greenman, before you go on, maybe you have this on the next slide, but could you just explain to the members what LAC is? I think a lot of folks might not know, and certainly the public doesn't know.
Sure. Sorry about that. Yes, I can. The state law has established what's called the Legislative Advisory Commission, and it is made up of chairs of the major finance committees. And essentially what it does, well, let me step back. State law requires that unless we're given specific authority elsewhere in statute, that a state agency has to get legislative approval to spend federal funds. And that limits, and in order to do that, the mechanism through which we get that legislative approval is through the Legislative Advisory Committee. And that's made up of chairs of the major finance committees with jurisdiction over a particular issue or a particular request for funding. And so what we've been doing quite a bit with the coronavirus relief funds and other federal dollars we've gotten is we've gone before what they call the LAC. And the LAC typically has, after getting a request to spend funding, the LAC typically has a period of time, depending on the type of request. It might be 10 days, it might be 20 days, in order to raise questions or objections to a particular request to spend federal funds. And then once that happens, the request is put on hold, and the department requesting this authority has to go back and answer some questions and provide additional information, after which the LAC may lift its hold. But after 20 days, if there's no request, or 10 or 20 days, depending on the type of request, if there's no action taken by the LAC, then it's assumed to be approved. That's how the process works. So next, we'll go to the next slide. I thought I would talk about the Medicaid provisions what we know about the Medicaid provisions that were included in the coronavirus relief, the American Relief Plan. So there's 7 major provisions that I thought I'd talk briefly about. The first one is mandatory coverage of COVID-19 vaccines and administration and treatment under Medicaid. That is 100%. FMAP means the percentage of the cost that the federal government will pick up. So that's the federal share of the cost of the program. I've also included in this table effective date, effective periods, so you can see, because there's different lengths of different durations of effective periods for these provisions, and also some notes about other issues that are pertinent to this committee. So the mandatory coverage of COVID-19 vaccines and treatment is required. It has 100% FMAP rate, so that means the federal government pays 100% of the cost. And that is effective to 1 year after the public health emergency. That's the federal public health emergency ends. And right now, we're thinking that ends. It's likely to last through the end of this calendar year. So we're assuming it'll go on till December 31st of 2021. So this provision would remain in place a year beyond that. The second piece is there's an option, and there's now a state plan option to cover pregnant and postpartum women during pregnancy for the first year after postpartum under the Medicaid program. This would be the regular Medicaid coverage with the regular federal and state match, which in most cases is 50% in Minnesota. So the state covers 50%, the feds cover 50%. This provision is effective from essentially for 5 years, from April 1st of 2022 to March 30th of 2027. The next provision is a state option to provide qualifying community-based mobile crisis intervention services, provide coverage for those services. This service would be covered at 85% federal match, which is, I should probably have said, in most cases, medical assistance covers in Minnesota the rate at which currently medical assistance covers services is 50%, where the feds cover 50 and the state covers 50. However, during the public health emergency, which we're currently in, we get an additional 6.2% federal match. And so the FMAP rate currently for most people in Minnesota is 56.2%. It's 90% for adults without children, but yeah. And so that's sort of the base rate so that you can kind of see then how the FMAP rates under this law benefit or don't benefit the state. So in this case, it's an 85% FMAP rate for these particular services. And again, this is effective for 5 years. And there are standards to qualify for these, for this additional federal match. And they also provide state planning grants. The one requirement with these funds is the savings the state derives from the enhanced federal match must be put back into supplementing services. So you can't you can't take a savings on it. You have to actually plow it back in, the money back into expanding services. There's also an extension of a 100% FMAP rate for urban Indian health organizations. And this provision is in effect for 8 quarters or 2 years. There's a sunset on the limit on the maximum rebate amount for single source drugs and innovator multiple source drugs under the MA program. This starts on January 1st of 2024. At this point, we don't have information about how much we're expected to receive in increased rebates as a result of this, because we don't get a lot of information about from the federal government about what rebates we're not getting. So we don't really know. We don't know to what extent we're currently under the cap, basically, and to what extent the cap would benefit us or not, or lifting the cap would benefit us or not. One provision that has gotten a lot of attention among the states and also generated a lot of questions is additional support for Medicaid home and community-based services during the COVID-19 emergency. And what that does is it adds 10 percentage points to the current FMAP rate for covered services. And this is available for expenditures between April 1st, 2021 and March 30th of 2022. The law defines home and community-based services, but also says that the secretary can set some rules around what it applies to and what it doesn't. It must fund the federal funds that come in, or the savings the state derives from the additional federal funds have to be used to enhance, expand, or strengthen home and community-based services. And they have to be used to supplement and not supplant state spending on home and community-based services. This is this is something that this is language that we've been studying at the department for a while, and still have some basic unanswered questions like that we've had some good discussions with the feds about, but haven't really gotten clear guidance yet on things like what's the difference between supplanting and supplementation. It may seem obvious, but it differs. What does it mean to enhance, expand, or strengthen a home and community-based service? And what's the period in which we can spend those dollars? Do we have to spend them all within 12 months, or can we have an extended period of time in which to spend them? We have not gotten that information yet from them. But
and Mr. Greenman, let me just pause there for 1 second. Representative Bonner has her hand up. And Representative Bonner, was this something that I didn't tell members in the beginning when I was going to call on them for questions, but should we let Mr. Greenman get through it, or is this something you need clarification?
It is specific to what we're talking about right now, and I'm feeling a little confused about something, and I was trying to look it up on my own, but perhaps others have the same question.
Please.
So maybe it's worth. All right. I'm just trying to better understand the FMAP process, and a couple of times now you have said that something is covered at 100%. And then other times you suggested that it was a matching feature. And so I'm struggling a little bit whether or not the government is picking up the tab for that, or whether or not the state is getting matched on dollars that they have. And it keeps going back and forth in your description. And so I'm really struggling with understanding the overall picture and how much a piece of that pie the state is going to be responsible for.
Okay, thank you for that, Representative Bonner. I think that is clarifying, Mr. Greenman, because if you have that question, I'm sure others do too. Thank you, Mr. Greenman.
Yeah, Representative Bonner and Madam Chair, I'm sorry for the confusion. I think those of us who talk about these things all the time just kind of use the terms interchangeably and don't realize it's confusing to other people. The way the Medicaid program is funded in Minnesota and other states is we have, it's a shared state federal funded program. And the amount of the federal share of the cost, or the federal share of the cost, is established by a formula in federal law that looks at population and income in the state. And what it does is it sets the federal, it uses that to set the federal share, or the federal match would be another way of putting it. The Minnesota has always had the lowest federal match in the country because of our income being fairly high relative to other states. It's always been about 50%. And so the state, so if you spend $1 on medical assistance, the state pays 50 cents and the feds pay 50 cents. And those 50 cents that the state pays is what you all appropriate every 2 years for the medical assistance program. That's what we look at, we forecast what we think we're going to spend, the total spending, and then we say, okay, we need to appropriate this amount then to cover the state share. There are other that 50% FMAP rate is not uniform throughout the medical assistance program. There are special rules around certain services or certain eligible populations where there's maybe a different FMAP level. So it's a different federal medical assistance percentage that the feds pay. For example, for adults without children enrolled in basic care, the the FMAP rate, or the federal medical assistance percentage, is 90%. So for every dollar, the state just has to pay 10 cents and the federal government pays 90 cents. And then there's some other rules around other services and eligibility groups. So what happened when the CARES Act was passed as part of the coronavirus relief fund or proposal? What the federal government did is they increased every state's normal FMAP rate by 6.2 percentage points. So the normal state share of medical assistance spending instead of being 50 cents and the feds covered 50 cents, the feds are now covering 56.2 cents and we're covering 43.8 cents. And so the state cost of paying for medical assistance for every dollar we spend has gone down fairly dramatically. And that's producing savings to the state because we don't have to spend as much for every dollar of medical assistance. And so this is all benefiting the state. And so when I talk about, and again, I apologize if I was being confusing. When I talk about 100% FMAP, what I'm saying is the federal government picks up the whole cost. We don't have to pay anything. And when I talked about the 85% for the mobile crisis services, again, the federal government is saying we're not going to pay just 50% anymore. We're going to pay 85%, and the state only needs to pay 15 cents. And so it's the same thing with this home and community-based services. Basically, what they're saying is they're going to take wherever you are, whatever a state's particular rate is, FMAP rate is, we're going to add 10% to that. So right now, because of the fact that we're in a public health emergency, and as I mentioned before, we have the federal law allows another 6.2 percentage point increase in what the feds pay in their FMAP. We're getting an additional 10% on top of that for services that qualify for this particular provision of the federal law, these home and community-based services. If we meet certain requirements, we'll get an additional 10% federal match, which produces savings to the states. And what the federal law says is you get that savings, but you have to put that savings back into the services.
Okay, thank you for that explanation. Representative Bonner, is that does it for you? Great. All right, thank you so much.
Yes, thank you. That's very helpful.
Okay, Mr. Greenman, we can move on, I think.
Okay. The last vision on the Medicaid provision is some funding, $250 million that can be split among states for strike teams for resident and employee safety in nursing facilities. This is available for 1 year after the public health emergency ends. It's mainly teams to assist with clinical care and infection control and/or staffing. Okay, and then if there's no questions, the last piece I was going to cover are the direct grants that the state receives as a result of this legislation. There are approximately $640 million in direct grant funding that DHS that will be allocated to DHS to respond to the COVID-19 in the state. And that funding is for a variety of purposes, and I broke it out into categories, including behavioral health, child care, child welfare, economic assistance and services for older adults and vulnerable adults. And so starting on the next slide, I'm talking about behavioral health funds. And I've got tables set up that talk about the program, the purpose of the program, the total amount of funding, this is in thousands, so these should be millions of dollars, whether there's a match or MOE requirement that the state has to pay in order to access the funds, whether we have whether we need the Legislative Advisory Commission to approve in order for us to be able to spend the funds, and then how long the dollars are available until. And so the first group is the behavioral health funds. For these two grants, there's no match or MOE. We are required to get LAC approval, and the funds are available until the end of federal fiscal year 25. The first one is a mental health block grant, and that's a comprehensive community mental health services. One thing I would note about this is that those dollars are not all that flexible. There's some flexibility, but 40% of it is specifically set aside for specific purposes. So we've only really 60% of the money is sort of something we have discretion over how we spend it. And then we also received a substance abuse block grant, and that was a total of $20,367,000, which need to be spent on COVID-related activities. So next slide, childcare funding. This is the big amount of funding that the state received. This is over $530 some million. These are all these require an MOE, which we currently meet. So we don't have to, there's no additional spending the state has to do to meet this requirement.
Mr. Greenman, MOE is maintenance of effort for those who
Yes.
might not know all the jargon. I
Yes,
know
sorry.
it's hard. I know we talk in these shortcuts all the time, but most, as we say in the legislature, normal people don't talk that way.
That
right?
I get told that a lot. Yeah.
Yeah. All right. Sorry. Go ahead.
We do have the authority in statute to spend these dollars. State law does specifically say these funds are appropriated to the Commissioner of Human Services to be spent on allowable activities. So just going down the list, the Child Care Development Block Grant is flexible state dollars that can be used for quality, for expanding services, for low-income families. And we've received a total of $203 million. Those funds need to be obligated by September 30th of 2023. But those are pretty flexible funds. We also received childcare stabilization funding, and these are to be used as sub-grants to childcare providers that are either open or temporarily closed, and help support them during the pandemic. This is very similar to grants that the state has been giving out since July of last year to providers to encourage them and enable them to stay open and meet public health goals and operate safely, basically. These funds have to be spent by September 30th of 2023. And then the last are child care entitlement grants, and these are mandatory funds that the state receives. This is actually an increase in the base funding for these activities, and this was $9,200,000. So that's an actual increase in the base funding. Their grants are one time. So the next set of grants are child welfare funding. These are both grants that don't require an MOE or a match. They do require approval of the LAC, and they are both available till September 30th of 2023. The first one is a child care or community-based child abuse prevention. These are funds that we can use to build programs to strengthen and support families and better understand diverse populations. And then the child abuse prevention and treatment grant provides improvements to the intake, assessment, and screening for child abuse prevention services. And the community-based grants are $4.37 million and $1.758 million for the prevention and treatment grants. The next set of grants are in the area of economic assistance and nutrition funding. These grants, let's see, the first one is a pandemic emergency assistance funds. These are for non-reoccurring economic assistance support services. These can be in the form of cash or some other mechanism. These are, if you want to think about how these funds compare, I would liken them to the temporary assistance for needy families block grant, which we use to pay for economic assistance support and support grants for families with children who are low income. This is a one-time $14.4 million allocation to the state. There is an MOE requirement, which we do meet. We do have LAC approval needs, and these funds are available till 9/30 of 2022. We're also receiving grants for administration of the SNAP program. These are two separate funds. One is about $11.2 million that goes to states and counties to pay for administration of the SNAP program. And the other is available funding for online purchasing and technology improvements. So these are things that states can use to strengthen purchasing program, electronic benefit transfer systems, and mobile payment technologies. We would expect to get about $500,000 in funding for that. the SNAP funds do not require an MOE, do require LAC approval, and are available until September 30th of 2023. And then the last set is programs for older Minnesotans and vulnerable adults. And there are a total of 6 different funds for these dollars. The first set, congregate meals and home delivered meals. These are nutrition programs that are available through area agencies on aging that we distribute the funds to them. It's about $12.3 million. There's a 15% federal match on that, which we already meet. So there's no additional spending the state needs to do to meet those requirements, and does require LAC approval. Those funds are available till spent, as are all of the other funds on this list. Home and community-based supportive services provide a variety of community-based services in response to the pandemic. This is about $7.5 million. Again, there's a match on these, which we meet, and the funds, there's no deadline, and there's LAC approval. There's funding for family caregivers, which includes information, respite education, training, and support groups to family caregivers. This is about $2.3 million one time with the federal match, and again, no deadline on spending. And then the remainder of the list of programs for older Minnesotans and vulnerable adults include these last 3. These all have no federal match or no state match or MOE. They all require legislative approval, and they're available until 9/30/22. These include the elder justice programs to improve interventions used to prevent elder abuse and neglect. It's about $2.8 million in spending coming to DHS. The protection of vulnerable and older Americans. These go to support the ombudsman for long-term care. This was $166,000, so it's fairly small. And then the last is the aging and preventive health funds that provide preventive health information and services to seniors. And this was about $728,000. So those are the grants that come directly to DHS through the bill that just passed. So I'm happy to answer questions.
All right. Well, thank you so much, Mr. Greenman. I see Representative Noor has his hand up. Representative Noor.
Thank you, Madam Chair. Thank you, Mr. Greenman. So my first quick question is on the economic assistance section. I did not see any of the TANF funds that the state may be receiving under this American Rescue plan. Is there any amount that is coming? Because I saw there was a portion for that. Am I frozen?
No, you're not frozen. We don't have video for you, Representative Noor, but no, we can hear you.
Anyway, so I just wanted to know how much is the state going to receive, or if there's any for the TANF block grant. And then the second piece that I wanted to ask is, because the funding is meant for supporting assistance to households. When I hear assistance, I always think about human services. What does that mean for the department? And then the final question that I have for you is some of the resources which are meant to be applied, resources that have been sent to the health and human services, for example, the public health workforce to, expand, sustain, and develop a robust healthcare workforce, which may not be in your jurisdiction. But are there plans for additional applications that the department is going to be sending to the agencies at the federal level? Those are my quick questions.
All right, Representative Noor, that was a lot of questions in one question, and I couldn't myself go back and remember the first one. Mr. Greenman, can you do that, or should we ask him to?
I can, Madam Chair, Representative Noor, I think I can respond.
Great, thank you.
So Representative Noor, I think we're talking about the same thing when we talk about the pandemic emergency assistance funds. These are very similar to TANF, and I think they're being distributed in the same manner as TANF is administered or distributed. They're used for essentially the same purpose. So I think I think in some cases they are being called TANF funds just because of that they're so similar. But essentially, that's what they're there for, is to provide states with some additional support to enhance what their TANF dollars are currently paying for, to use the enhanced dollars to pay for similar services on a shorter term basis, so to support families. And you also referenced that the fiscal recovery funds, one of the uses is to include to respond to COVID's economic impacts or negative impacts on, including providing assistance to households. I think that is, like I said, we haven't received the guidance from the federal government yet, so we don't know exactly what they're going to say we can use these dollars for at this point. I know that in the previous iteration of these funds, the coronavirus relief funds were allowed to be used for things like food assistance and I think to pay some housing costs. So there was some flexibility in those funds, but they didn't. But the law didn't specify how those dollars could be used. So, given this language explicitly says it can be used to provide assistance to households, I'm guessing this is going to be even give states that want to do something to help households and provide assistance to households even more flexibility to do that with these funds. But I'm just speculating that's probably the case. But I'm not sure exactly, like I said, I'm not sure exactly how we can spend those dollars. And I think the last question you had was about public health workforce. And I believe my colleague from the health department can probably speak to that better than I can when he comes up.
Yeah, so that's the staff is telling me that as well. So any follow-up, Representative Nora, and we could hold that last question till we get, okay, now I'm being told that no, that isn't something MDH is involved in. So I don't know. Representative Nora, do you want to follow up?
I appreciate it. I think those are things that we may want to look into in terms of defining the assistance. I didn't want to go into the other sections because we have lots of questions and we don't have guidance, such as support for essential workers. What does that mean? And when it comes to our area, I understand that also there's a segment that talks about economic for small business, but also for the nonprofits. All those things will have an impact on the work DHS is doing, or the Department of Health. So I can follow up later on as soon as we get more clearance, and guidance from the federal government.
All right, thank you, Representative Noor. And I think Representative Comm is next, and then Bierman.
Thank you, Madam Chair. And I was just curious if any of these funds could be utilized to directly pay rent, so that I know there's a lot of issues in affordable housing, and I'm just curious because that way you can, I guess, make sure that the funds that are meant for that are going to that, and we don't have future issues.
Okay, and Representative Comm, I don't know, some of this might be within the DHS jurisdiction and some of it might not, but Mr. Greenman, can you address that, at least whatever's within the DHS jurisdiction? Because we do have jurisdiction over some homelessness funds and so on.
Certainly, Madam Chair. We have used some of the coronavirus relief funds for services for persons who are homeless, isolation and homeless shelters, things like that. And I really wish we had some guidance from the federal government to give us a little more information about what we can use these dollars for. But I think it's something we should be looking for, whether there's opportunities to do that with these dollars. I think the other place to possibly ask would be the Housing Finance Agency. There may be some funding there for them. I'm not sure. I know they got quite a bit of funding. I just don't know what specifically it's available for. But I think I think we'll have to see what the guidance says.
Okay, thank you. Follow up, Representative Quam?
Madam Chair, I would just thought it'd be useful offline, maybe some additional information could go to the committee members, because affordable housing and a lot of housing is very stressed. And it'd be nice to have some good news about, I guess, any good news that we passed on to constituents. Thank you.
Right. Thank you, Representative Quam. And I'm pretty sure there are other monies in this package that are coming through, but they're not in our jurisdiction for these two committees that we're talking about today. So I'm sure that MMB will be providing more information as it becomes available. Representative Bierman.
Thank you, Madam Chair. And the American Rescue Plan is certainly good news for all of us with the funds coming our way. I have three questions, but I think they're pretty quick. So thanks for the presentation, Mr. Greenman. The first one is, as we go down that list and look at all of these programs and provisions and grants, would I be right to assume that we're just going to take an all of the above approach? Is there any that are optional that we would not take advantage of?
Mr. Greenman.
Madam Chair, Representative Bierman, I think the department is looking at, in terms of the funding for that specifically goes to DHS, the grant allocations that specifically go to DHS. We are looking at, what's the best way to spend those dollars. I don't think there's a thought being given to not spending them. I think we're looking at how best to, because there's certainly the need out there. So we'll be looking at how best to spend those funds. Some of the Medicaid provisions, I think our Medicaid director and his staff are looking at whether it makes sense for us to do some of those. Some of them will require legislative action. And so it would be within the legislature's jurisdiction to decide whether we wanted to pursue some of these or not. I think some on the face of it seem pretty appealing, but I think we want to see sort of what the details look like and spend some little more time talking to CMS about them.
Thank you, Madam Chair and Mr. Greenman. That kind of goes to my second question, which was, you mentioned legislative approval. So I just wondered how that worked, if we had to do something before you applied for the funds, or if you just got the funds and then we had to okay the spending. So that sort of answers that, or it goes to that question. And that was number two. I'll just connect number three on here too. And that was in regards to the one that you spoke about for an extended period of 1 year postpartum. And we had a bill in session this year, Rep. Richardson, I believe, and I think it was like Bill 520 something. And so I'm just wondering if this would replace that bill, or if that's a bill that we would still carry forward, and maybe that's for chairs to answer as well.
That's a really good question, Representative Bierman and Madam Chair. The bill that you had, I believe, the only difference between what is allowed under this federal bill and what you were proposing to do is how we get federal approval to actually implement it. Right now, there's not. It's not part of the state plan services for DHS to cover medical assistance for an additional year for a woman postpartum. To guarantee that, we would have to ask for a federal waiver to do that. So a waiver from the regular Medicaid law to do that. And that's what this bill would have presumably done. What happens under the federal law is it becomes something that you don't need to ask for a waiver for anymore. You put it in your state plan that this is what we're going to do. So that's really the only difference. So yes, I mean, I think they're fairly, and our Medicaid director can correct me, but I think that they're pretty similar other than that.
So Representative Bierman, I was taking note of that, and I'm sure that Representative Morrison was as well, because that is actually her bill.
Oh, okay.
And I'm kind of disappointed to see that because I was under the impression that the federal government was going to actually pay for that, but apparently not. So absolutely, that would have been a great thing to see. But, you know, that they won't make us ask for the permission to do it. I guess that's something, but they apparently didn't want to pay for that one. Other follow-up, Representative Bierman?
No, that's all, Madam Chair.
All
Thank
right.
you very much. Thanks.
All right, thank you. Well, we're going to pretty soon here let Mr. Greenman off the hook, but I had a couple of questions, Mr. Greenman. So of the $5.277 billion that are coming to the state, I wasn't exactly clear from what you presented whether the Medicaid-related increases in match, the federal match increases, is that part of the 2.577 or is that in addition to the 2.577 billion?
Madam Chair, are you asking whether the federal match is of the Medicaid match is part of the?
Yeah, is that counted when you're in that bucket of, you know, very large bucket of money, $2.577 billion. And that's of course divided into all kinds of sub buckets, if you will. But we're talking about the things for which we're going to be given an increased federal match.
Mm-hmm.
And I'm wondering if that increased match is counted in this bucket of 2.577, or is that something that's in addition to that?
Madam Chair, it's in addition to that. Yeah, these are
all right.
Because the Medicaid pieces are largely optional. We can choose to do them or not, but we know we're going to get the 2.577 billion.
Okay, thank you for clarifying that. And then finally, my final question is kind of a really, really basic question. I have a document in front of me that calls this the American Rescue Plan Act. And I've heard it now referred to with a bunch of different words for that R. Is it recovery? Is it rescue? Is it, you know, I just want us to, at this early time, get all on the same page. And if we're referring to the same thing, which I assume we are, do you know, is it rescue plan? Is it recovery or what exactly?
I think you got me, Madam Chair. I think it is. I'm looking at another document that says it's recovery. So you're right, it's recovery.
No, well, I'm saying it's rescue on my document, but I don't know which is correct.
Oh, no, it's rescue. I'm sorry, it's rescue. I had recovery. You're right, it's rescue.
Okay, all right, very good. So when you say recovery, you mean this, we're all talking about the same thing at least, right? Yeah, thank you. Thank you. Really appreciate that. Mr. Greenman, did you have any more you were going to share with us, or did we came to the end of your slides, right?
I'm sure I was all done. So.
All right. Well, very good. Well, thank you. I know we're all tired trying to get our work done right about now in the session. So thank you very much for taking time to do this.
Thank you.
So we're going to turn now to the Department of Health, and Mr. Bunker is with us, and he has a presentation for us as well. Welcome, Mr. Bunker.
Thank you, Madam Chair, and chairs and members. Good afternoon.
And Mr. Bunker, you're very soft.
Thank you, Madam Chair and members. I'm looking at the title of my first slide and wanting to make sure that I am correct as well. Thank you for time this afternoon to go through MDH's portion of the funds that are coming into the state. Thank you as well to DHS and Mr. Greenman for really laying the foundation, providing a great overview and introduction of the Act itself. And my presentation will follow right underneath that umbrella and move into the COVID relief and prevention activities that move through MDH. Next slide, please. As Mr. Greenman presented, there were some items that certainly were specific to the direct funds that would come through that organization. The estimated funding that is coming to MDH is presently estimated at $287 million of grant funding. Now that is different than that I'm noting on the second bullet of this slide, and as was submitted through the Legislative Advisory Committee process, where earlier we were anticipating $868 million coming into the agency as direct grant. That was due to our not having received exact funding information and guidance, similar to what Mr. Greenwood was sharing. And so we applied the proportion of our funds received in the earlier federal COVID legislation to arrive at that higher $800 million amount. We have received some slight adjustments since then, and we are down to just under $300 million. And we will provide updates, and I will share where those changes are taking place as I go through this presentation. As also was mentioned earlier, the guidance on our final amounts still could be within 3 to 4 weeks off. And so we are waiting with bated breath on both the final amounts and the guidance that would give us understanding of the exact parameters within which we would be able to spend these funds. In addition to the direct funds, I'll be sharing at the very end of this presentation one grant that MDH is applying for that will be a competitive award out of the ARPA, which may be the safest way to refer to it at this time. Next slide, please. Of our estimated amounts, and again, emphasizing and apologies for estimated amounts at this time, in a presentation that from left to right follows very closely on what you saw from Human Services, we are also including on the far left the federal funding agency, and for some these are sub-agencies, a description of the program, the purpose of that program, the funding amount, whether we know at this time whether there is a match or maintenance of effort requirement. And actually for all of our awards, we believe at this time that the Legislative Advisory Commission approval will be required. So beginning at the top of this chart then in terms of the awards, out of the Department of Agriculture, WIC funds that would be COVID supplements to the program that we are now funding that would increase the amount of cash available for those nutritious food purchases. That would add an additional $8 million. Again, we don't know the exact parameters. However, no doubt there will be some urgency with this to address the economic relief that a number of folks surely need at this time. The next item on the list, that acronym stands for Health Resources and Services Administration. And this would be with our early infant childhood and home visiting program. So this would supplement existing programs at the agency, and that would be serving pregnant women and their families. The next, for $3.4 million, unsure, as shown on this chart right now, whether there's a required match or maintenance of effort. The last item on this page is through the Environmental Protection Agency, related to addressing health disparities, pollution impacts that have happened as a result of the pandemic for our communities. Again, we have seen the amount, but we are not sure of the guidance, what these monies can be used for at this time. Next slide, please. Moving on, this next acronym, the Substance Abuse and Mental Health Services Administration. This is a sub-agency of Health and Human Services. This would supplement existing funding that we receive right now in grants, focusing on youth suicide prevention and early intervention. So this includes the potential of funding for tragedies as well. And this is in the amount of $5,000 with no required additional match or maintenance of effort. The last award on this page is from Health Services for the National Health Service Corps. This is supplementing existing programs within the agency that would offset and pay back loans for folks, especially who are looking to work in rural areas or underserved areas within the state. And so those who are involved in providing healthcare and are going through programs now, this would offset their loan costs and provide scholarships in the amount of $1.8 million through this funding mechanism. Next slide, please. These three slides on this page are the CDC awards. You will see that a couple amounts are missing on the page, but with the top line, we are receiving some clarification that the monies in this ELC lab capacity will be focused more on school testing and will address the question of reopening safety and mitigation related to school efforts and testing to get students back in classes. This was the amount that changed most greatly and brought our revised anticipated amount from mid 700 millions in this one award down to $170 million. So this is an area that we are also watching and need to understand as we receive guidance, the exact parameters of allowable activities within this area. No match required for this, just under $170 million. The next award that we are seeing as an area, but not carrying a dollar amount, is to support immunization activities. These monies are going to be supplemented into an existing funding stream, which is identified as immunization and vaccines for children. That doesn't mean that it is restricted to vaccines for children, just using that funding mechanism. And the TBD is because I was so very off in estimating using our earlier formula for amounts that I didn't want to keep the projected $85 million on this page at this time because of that uncertainty. Whatever funds we do receive will be on top of a $51 million award that we received a number of months ago to increase and support our efforts in this area. And finally, we have the last direct grant into the agency in genomic sequencing and surveillance. This would be to enhance the state's effort to identify and then use information from tracing the variants as they have opportunity to mutate, so we can try to stay abreast and move forward of their potential negative impacts upon our state. Again, a TBD amount. There was an amount of $17.5 million that, when we use the earlier formula, would have been in that cell on the page, but a little hesitant to keep that there at this time as a solid number. And there is a last slide. This is the one competitive grant opportunity that we are aware of at this time. And there are monies that are available for competitive application from all states in the country, but this particular pot as well is from CDC, looking to promote equity and address disparities in the COVID-19 response. And so the agency is preparing to submit a letter of intent to the CDC saying that we are interested in applying. And I've included the top amount that a state could apply at this time. We will see what happens once we put together that application and submit it. This would be an award that will be submitted fresh that is not included in the others that went through the LAC process. And so in the next weeks, this will be an additional item through the LAC, Legislative Advisory Commission.
All right. Well, thank you very much, Mr. Bunker. That's really helpful. If you could, we have a question from Representative Pinto. And if you could stop sharing the screen, whoever's doing the sharing here, that'd be great. And we can see each other better. Representative Pinto.
The reason I'm smiling, thank you, Madam Chair. The reason I'm smiling is because my question actually did, of course, wouldn't you know, it have to do with a slide, which was just the one, and it may not be necessary even to bring it up, though I can just maybe ask about it. There was the row about immunization and vaccines for children, and then there was a purpose listed that I thought was maybe a mistake, like an error in copying a cell, but then because it references what seemed to be similar language as the MICV, the home visiting information. I was a little bit confused about whether either it was a different purpose or if I just had misunderstood kind of how that worked.
Mr. Bunker, do you need the slide back up? We could certainly.
I do, unfortunately.
Okay, all right.
Chair.
Ms. Tamian, please put the slide back up if you can. Thank you.
Madam Chair and Representative, as I'm looking at the slide quick copy on my desktop, yes, indeed, that is an incorrect description. That does match the McVie. I apologize. That was an oversight when putting together this slide. These funds would be used to support expanded vaccination activities across the state, including the opportunity to provide grants to local public health to fund community-based organizations and federally qualified healthcare providers.
Thank you, Madam Chair.
Thank you. Thank you, Mr. Bunker. Boy, sharp eyes, Representative Pinto. Okay, Representative Noor.
Thank you, Madam Chair. I just wanted to go repeat back the question that I asked previously about the.
Please.
So this is the question. I know that the department chose to do one portion of the $7.9 billion set aside for helping with the healthcare workforce. And quite frankly, this was meant to really establish a robust program for, especially in areas where we do have significant disadvantaged and low income communities. So is there a plan to apply for more resources through the Department of Health? Or are we saying this has to go through the Department of Economic Development? I haven't received an answer, so I just wanted to check back and say, what is the plan to help us increase the number of healthcare workforce based on that program?
So Representative Noor, are you talking about what was on the slide with regard to loan repayment?
Yes, that was one portion of the $7.9 billion set aside through the HHS, if I'm correct.
Mr. Bunker, can you address that?
Madam Chair and Representative Noor, that loan repayment opportunity is the one area that I'm aware of for a direct grant at this time. I will go back into the Act and take another look with staff at those other areas that you're identifying connected to what you're saying is the 1.7 that is for that purpose.
Madam Chair, it says it's $7.6 billion to the Health and Human Services. It's meant to establish, expand, and sustain public health workforce. So that is more specific about public health, and I was assuming that Department of Health will take the lead. It's meant to do the recruitment, the training, the hiring, including investigators, social support specialists, all those things that are meant to support what we're dealing with right now. And particularly, this was meant for medically underserved areas. That's why I'm bringing it forward, so that we can prioritize this opportunity that we have. In fact, the note indicated that we will be establishing 100,000 new healthcare workers through this program. So I'm hoping we can emphasize on that and really take advantage of resources that are available through the federal program.
Yeah, amen to that, Representative Noor. And boy, we could use help, especially, I know, like dentists and primary care providers and all kinds of healthcare workforce folks really are in shortage.
Madam Chair
Mr.
and
Bunker.
Representative Noor, as Mr. Greenman presented, at this time we've identified $2.6 billion coming directly to the state and an additional $2.1 billion going to the local level. We certainly can take a look at how that $7.6 billion amount fits into or is represented in any of those funding areas, and can get back to you with a response of what we find. I'm just not aware of that at this time.
All right. Thank you, Mr. Bunker. Other questions from members? All right. I'm not seeing any. Thank you very much, Mr. Bunker. I think, this is certainly there is a lot of opportunity here for us as a state. And, but it's going to be challenging to get this all figured out, especially, on a short timeline. So I think we've got a little bit of a taste here of just how complex this is. So I think we can end the hearing if there's no other questions or comments from members. So not seeing any. So do take a look at the materials that were sent out, and I hope that members are able to enjoy some rest and time with family and get outdoors a little bit during the week. And wishing you all, to those who are celebrating holidays, wishing you all the best for those holidays. And with that, we are adjourned.